concerning the vaccination against COVID-19. My name is Marjorie Côté-Boileau with Minister Christian Dubé. Minister Christian Dubé will speak about the vaccination against COVID-19 briefly, and then the director of the Quebec COVID-19 vaccination campaign, Mr. Daniel Paris, will speak, as well as the public health strategic medical advisor, Dr. Richard Massé, will also be available to answer questions. Mr. Dubé. Thank you, Marjorie. So hello, everyone. As of today, we are going to be starting a new way of doing things to broadcast data. We are going to talk about the data on the state of COVID in Quebec, the death toll, the cases, the case count, hospitalizations at 11 o'clock, as we have been doing, but all the data on the vaccination aspect. So the good news is going to be given and will be published at 1 p.m. I would like to go over the vaccination in Quebec. I'm announcing to you that a first dose was given to 8,339 people yesterday, which now brings the total to 115,000 people who have been vaccinated. As of now, we have received 14,950 doses on Tuesday, as was planned. 5,850 of these new doses yesterday, which makes it that up until date, we have received 162,000 doses since the beginning of the vaccination campaign. We are, as an objective, still at being at 250,000 in February, so the deliveries are going very well. More than half of CHSLD residents now have received a first dose of the vaccine, which is also good news. We now have used all of our first doses. Right now, we're vaccinating with the new Pfizer doses that we received in the past few days. And as you've seen for many days now, the vaccination is going very well. Great thanks to the vaccination team and Mr. Paris. However, it's not because we're vaccinating, and I really want to put an emphasis on that we have to slacken on our good practices of infection control that we've taken in the past few months. Because as I've said, I really want to insist on that. Very often in our CHSLDs where people have been vaccinated, we feel that people are slacking off because people know that they immunize. But I want to send out a message that vaccination is an extra measure, but we must remain extremely vigilant with our hygiene measures that have been set up. So that's important to repeat. And as Public Health mentioned during a briefing a little bit earlier on, our experts right now are recommending that the second dose of the vaccine be administered between 42 and 90 days after the first. And in our context, that is the best strategy because we have to take into account very few vaccines, as you know, and we are in a race here. And Mr. Massé will be able to answer specific questions on that. Our strategy is very clear. We want to vaccinate as many vulnerable people as possible to save lives and to reduce the pressure on our healthcare system. Saving lives is a moral imperative. Reducing the number of hospitalizations is a necessity. And the more doses we have, the more we're going to be able to decrease the delay between the first and the second dose. Now, we talked a lot about RPAs, and I'd like to say a few words on RPAs. We have, those residences for the elderly. We recently had to make decisions that are heartbreaking and set up extra measures in RPAs. I'm just thinking, for example, of the cafeterias. It wasn't something that we did happily, but we did that to protect the residents. There are still many outbreaks in those living environments where there's a lot of mobility, and we had to therefore make sure to avoid gatherings and contacts to avoid for this transmission to accelerate. The good news is that with the recommendation that was emitted by Public Health to delay the second dose up until 90 days, that will allow us to vaccinate RPA residents more quickly because they come after our healthcare employees and CHSLDs. And the establishments and facilities that are planning for the vaccinations in RPAs should start on the 25th of January. And that's important. I think that many people today were getting a lot of phone calls. The vaccination campaign in RPAs will start on the 25th of January. So I wish to tell residents in RPAs that the light at the end of the tunnel is getting closer and closer. We're doing as quickly as we can to vaccinate everybody so that you can go back to as normal a life as possible. Now, going over the cases, but particularly the hospitalization toll, which is my last point today. To end, I would like to say that in the past few days, we can see that the number of cases seems to be stabilizing around 2,100. However, you've also seen, for those who are following that closely, and more people are following that very closely, hospitalizations are still increasing. So yes, there's an improvement in the case of the number of cases, but the situation for me is still very worrisome, most particularly as far as the hospitalization rate is concerned, and that is why we can still see a very great number of deaths. And I know I'm repeating myself, the cases have repercussions on hospitalizations in the days and weeks following the cases. So the 1,500 hospitalizations that we have today is the result of the very strong increase of cases that we had in the past weeks. So this morning, you were able to see it, and I repeat it for people listening to us, the INES projections, the National Institute for Excellence in Public Health, shows that the situation is very fragile in our hospitals. We've explained it. The curfew was precisely to stop the number of cases and lower the pressure on our network. So just very quickly to conclude with, I'd like to summarize by saying that this is not the time to slacken with our efforts. I've been saying it for a long time, but we can see that, we have good news in terms of cases, but we're not yet at good news for hospitalizations and the death toll. So I want to clarify that those who do not respect the rules are hurting Quebec at large. I want that to be very clear because the decisions that we're making today as individuals have a collective impact. And if we do not reduce the contagion and the spread, confinement and lockdown might become longer and even more severe. So rather than asking yourselves how you can avoid the rules, why don't you ask yourselves how you can comply with them? We have to play as a team. We have to beat this virus. We have to be faster than it is. And if we play as a team, we will win this road race. English?
First of all, starting today, we will release the data on the state of COVID in Quebec. Cases, death, hospitalization, and tests at 11 a.m. as we do. But for vaccination, the data will be released at 1 p.m. So here are the results for the vaccination in Quebec. At first, a first dose was given to roughly 8,000 people yesterday, bringing the total to 115,000 people vaccinated. We have received 40,000 doses on Tuesday. 5,800 of them are new. Doses yesterday, which means that we have received 162,000 doses since the start of the vaccination. More than half of CHSLD residents receive a first dose of the vaccine. This is a very good news. As you have seen for several days, vaccination is going smoothly in Quebec. However, this doesn't mean that we have to let go of the good PCI, prevention and control of infection habits we have developed over the past few months. As public health mentioned during the brief earlier with my colleague, our expert recommend that the second dose of the vaccine be given between 42 and 90 days. In our context, this is the best strategy because we have to deal with very few vaccines. The more doses that we have, the more we will be able to reduce the time between the first and the second dose. Now, I would like to say a few words about RPA. We recently had to make heartbreaking decisions and implement additional measures in RPAs. There are still several outbreaks in these environments. It was therefore necessary to ensure that gathering and contacts were avoided to prevent this transmission from increasing. The good news is that we have recommendation by the public health to postpone the second dose for up to 90 days. It will allow us to vaccine residents of RPAs more quickly. In fact, vaccination in RPAs should start on January 25th, which is very soon. In the last few days, the number of cases have stabilized around 2,100, but hospitalizations are still on the rise. At the risk of repeating myself, the cases affect hospitalization in the days and week that follow. This is where we are. So the 1,500 hospitalizations that we have today are the result of the increase of the case that we have experienced in the last week. So now it's the time to release our effort. I also want to clarify that who do not respect the rules harm all of Quebec, because the decision we make individually have a collective impact. We play to a team, we play as a team. We have to beat the speed virus, and if we play as a team, we will win the race against the time. Merci beaucoup. Thank you.
So now we'll go to the question period. Explaining questions.
Via Zoom. Alors, pour les gens en Zoom, je vous rappellerai que c'est un média, un représentant par média, et aussi de lever votre main là, via l'application pour que je puisse adresser la parole. Pour la première question, nous allons y aller avec Annie Guillemette, Cogeco Nouvelles. Bonjour. J'aimerais savoir...
I would like to know, are we able to quantify what that delay of the second dose is going to mean? You were talking, Mr. Minister, of RPAs that will be vaccinated more quickly. Do we know how many people, how many vulnerable people that represents that will be vaccinated more quickly? Well, we can keep it simple because I don't have my chart with me. But from the presentation that you had this morning, remember that we had already planned at the beginning of March for the second doses for CHSLD staff as well as public health to about 50,000 people. So we're moving things around that allows us to vaccinate a greater number of people, but perhaps more technically, the principle is to vaccinate as many people as possible, particularly amongst those vulnerable. Perhaps Mr. Massé could give more information. What that will allow us to do is to be able to start vaccinating not only RPA people, but also those people who are 80 and over and people who are 70 and over. So people who really are at high risk. Of course, there's fewer complications, a little bit, but still quite a few complications. And we've calculated that would allow us to not 42 years more, but to anticipate close to 500,000 people. So 500,000 people will be able to anticipate their vaccination. So we'll be winning a few weeks that's missing, that's going to be gaining and reducing a lot of hospitalizations, a lot of deaths. So it's an important gain in terms of the protection of the population. Speaking of impact, Mr. Minister, you opened the door for more draconian measures in terms of curfew or restrictions that could be imposed. What would you need for the curfew to be lifted on the 8th of February? Well, you know that we've always said that it's a series of factors that helped us to make our decisions, and it's been that way since the beginning. Let's take, for example, as a half good news, that there was a lowering in the half cases. I can say it that way because I want us to remain on our guard, because we've said it. The number of cases is one thing, but hospitalizations, and you heard Dr. O'Patterney this week talk about it, it's not very, it doesn't make us happy what's going on in all of our great hospitals, especially in the Montreal area. So I think it is still too soon to be satisfactory. I think that we can be happy with the direction that we seem to be taking right now, but I would say that all that I would want is for Quebecers to realize that we have to continue making the efforts that we were. It seems to be working. but it's too early to say that we are succeeding.
Au micro 2, je rappelle que c'est question sous question aux médias. Si vous voulez spécifier votre nom et votre média, s'il vous plaît.
Bonjour, Monsieur Éric Plouffe de Radio-Canada. J'aimerais
I would like to hear you about the different discussions that you must have had with pharmaceutical companies as well as the federal government on this delay, which can go up to 90 days, because the federal government didn't agree, was rather in favor of a 42-day maximum delay. And some people are wondering whether it might not compromise, perhaps, sending more extra doses if we do not respect the recommendations of the pharmaceutical companies. Well, listen, you heard the Premier this week when we talked about it the first time, who said that never would we neither would we allow that to happen. But the good news, after the long discussions that took place by Dr. Arruda with the different federal counterparts, and I'll ask Mr. Massey to complete, but I would say that up until the very last few hours, the recommendation not only of the federal counterparts take into account the particularities of the provinces and their own situations. And I think that that is a point that Dr. Arruda managed to explain very well to his colleagues from the other provinces as well as the federal government, that it's all very well to have certain limits, but in Quebec we don't have the same situation that they have, for example, in New Brunswick or in British Columbia. So that third element has helped in the thought process that took place. That's my first point. The second point, I think, is just as important, and it is that we say it, and we're very close to Pfizer. There's been discussions, even just this morning, in the public health team. We have to also explain to the manufacturers what our specificities are. So we do it with the federal government and with the different parties involved, but there's a lot of proximity between the Quebec Public Health as well as the manufacturer to be able to explain what our position is. But I would say, just before handing over the mic to Richard, that one thing is for sure, never have we questioned the fact that we want to give a second dose. It's just, that we're going to be given a second dose is obvious. It's just to know what leeway we can have. What leeway can you give us so that can really vaccinate our vulnerable people? And if there's any other specificities, I'll leave the mic to Mr. Massey. On top of the commitment of giving the second dose, it's also being able to monitor the situation in order to see what the level of immunity and protection that we could have for the vaccination. Because the data up until now went up to 42 days. It doesn't mean that it's not efficient after, on the contrary. It's just that the data that we had from the studies only went up to 42 days. So we're going to be continuing with that evaluation, and we'll be following not only in Quebec and in Canada, but what is going on elsewhere in the world. One thing that is certain is that people understand that the epidemiological context is very important. In Eastern Canada, there was very little transmission. So the pressure to give the second dose now is not something that is like here, where the transmission is a lot more significant, and the impact of delaying by a few weeks, we're only talking about a few weeks here, the impact of delaying by a few weeks from a point of view of community transmission is very significant here. So that is a really appreciable gain. So it is possible that we'd be able to give it before. If we can give it earlier, we will. If we realize that there are populations for which the protection is not as good because we don't have as many data for the vaccination efficacy, well, we'll adjust ourselves. And we've given ourselves as a maximum delay 12 weeks, which will allow us to get extra dose and to really protect people well. You were talking about the worrisome rate of hospitalizations. If Montreal wishes to open more beds but has a lack of nursing staff, would it be possible to do what was done during the first wave, that is, of transferring staff? The answer is yes. And I think that Dr. O'Patterney did say that we have about all these solutions on the table right now. I'd like to take advantage of this to say that one of the solutions, the work that was done, for example, by my colleague Danielle McCann, to go get nurses, you remember, we're now over 500 people registered to the program. It's these kinds of initiatives that we have been setting up. So I would say that we're looking at everything, but the best news that we can have, that we could have, is to have stabilization in hospitals. That is what we owe to our health network, is to continue with our efforts to reduce the pressure.
Via l'application Zoom. Alors, on va y aller avec Alain Laforêt, TVA Nouvelle.
Bonjour à vous trois, vous m'entendez bien?
Peut-être un petit peu plus fort, M. Laforêt.
Could you turn up your sound, please?
Je vais enlever mon masque, ça va aider.
And I'll remove my mask, that'll help. So my question is for Dr. Massé. Dr. Massé, just a few minutes ago, Dr. New in Ottawa said that we had to follow the 42-day target. What I understand is that you're going to 90 days not knowing whether the immunity of the vaccine will remain. In fact, the epidemiological data show that the vaccine is still very efficacious at 42 days, so it was measured over that period. It's just that there's no scientific data that was presented that were made available for the period following. That being said, we work with many vaccines, and we have been working with many vaccines for a long time, and we know that immunity is not something that stops, as if you hit a wall. It continues in time. And that is what we will be monitoring, not only us, because this is not a question that is only specific to Quebec. In Quebec, in the rest of Canada, in the United States, everybody's monitoring the same thing. Everybody's asking themselves the same question. So the experience that we have, and the very great experience that we have in that, shows us that it is something that is safe, that is efficient. It's a delay of a few weeks. We would love to respect the 42 days. But between the choice of lengthening by a few weeks, knowing that the experience of vaccination allows us to do such a thing, even if it's a new vaccine and that we are missing data that is specific to this vaccine, the impact of vaccinating more people who are elderly, for whom there's a higher risk of hospitalization and death, that is a balance of risk that we have to make. And we clearly think that the balance of risk is in favor of protecting more people. But we're following the situation. And if there were to be subgroups where we realize that immunity was not as good, we would act and give them before. And as soon as we are able, we will shorten that delay to get closer to the 42 days or even less if it's feasible. So it really is like a balance of risks, and it is quite comprehensible that we have to make that kind of choice. In Canada, the public health directors have recognized that the epidemiological context has to be taken into account, and that it is a choice that could take place when there were situations of transmission that were very high, which is not the case everywhere in Canada.
Ma deuxième question est pour Monsieur Paris.
Mr. Paris, we know that right now, and you said it earlier today, and we knew it as of yesterday, that there are regions in Quebec that do not have any vaccines. They just cannot vaccinate. How many regions don't have vaccination right now, and do you think what could happen over the next few weeks before supply is at its max? Well, listen, today we expect that the beginning of the vaccination in regions that didn't have enough vaccines is going to start again. We are waiting to get some deliveries tomorrow from Moderna, 34,000 doses. And what we will do is that we will be redistributing them over the weekend in order to be able to properly supply those regions so that they can vaccinate. What you're mentioning as a situation shows very well, in fact, today, the lack of ability between our ability to vaccinate and the actual vaccines that are supplied to us. Once we have more vaccines, and that's the element that you're mentioning, that there are regions that have to stop vaccinating, we won't see it anymore as soon as we get more. We don't want that. We want to vaccinate.
Oui, bonjour messieurs. J'espère que vous m'entendez bien. Monsieur Massé,
Mr. Massé, I would like to come back to the 90-day period. What made it that you went up to 90 days rather than, say, 60 or 120, if we think that there is no probing value after 42 days? Because 90 days, first, is a short delay, and it allows us to be able to reach those clients that are really important. We talked about RPAs. but we also mention people 80 and over, 70 and over, and that will allow us to be able to get to those people so that there's a maximal impact in those people that we'll be able to get to earlier. And as soon as we can, we will shorten the delay. But it really is to be able to reach those people who are extremely vulnerable. That gives us a few weeks more to be able to get to them and protect them. Mr. Dubé, there are families that had accepted being vaccinated, taking into account that they would receive a second dose pretty quickly. What do you have to say to them now that they're being told that they might have to wait 3 months before the next vaccination? Well, I would say first that it's a maximum of 3 months because, once again, we are going to, I think that Dr. Massey said it very well, the recommendation that public health is giving us is to say that it is a maximum of 3 months. Second, we are going to be following the evolution. I'm repeating myself here, but in my own words, what that means is that we are going to follow the evolution of each clientele group. People who are vaccinated in CHSLD, we know them by name, we follow it. If there are things that will happen, we'll follow it. And if there was a need of readjusting our policies over the next few weeks, we will do so. So I want to reassure people. People have had the opportunity of being vaccinated first, but there are truly high-risk people as well, and that is the choice that public health has made in its recommendations. We want to maximize the number of vulnerable people that we vaccinate. I really appreciate what is being done right now, and we will be continuing with the monitoring of the situation.
Vous pouvez y aller, M. Gagnon.
Il y a un décalage horaire avec Québec.
Sinon, le temps de rétablir le son, on pourra passer à Fanny Lévesque de la presse.
Oui, vous m'entendez bien?
Oui, très bien.
Parfait. Je voulais savoir...
I would like to know, we learned this week as well that the Pfizer vaccine, the 960 dose could be divided in smaller portable units. I would like to know, Mr. Dubé, to what extent that will change things in the vaccination campaign in Quebec. Oh, well, I will refer that to our vaccination expert, Mr. Paris. Well, first, it's excellent news. To have the ability to moving vaccines around will allow us to be closer to certain clients. Mr. Dubé mentioned it earlier on. We are going to start vaccination in RPAs the week of the 25th of January. But having the possibility of having smaller numbers of Pfizer doses means we'll be able to move and vaccinate people directly in the residences. That's what the difference is. It doesn't give us more vaccines, but it gives us a lot more agility. I'd like to know, yesterday, Mr. Dubé, the Montreal authorities were saying that they needed help. It was evoked by a colleague. What is the plan to help Montreal in hospitals? Are we thinking of moving staff around from other regions? And what is the possibility of having recourse to the army, like during the first wave? Well, concerning the army, I'm going to start with the second part of your question. We are, well, first of all, I would say that we're always going to accept the help from the federal government that is offered to us. I think that where we're at today, if there is one place where the federal government, and we'll talk about it tomorrow with them because I have a meeting with my provincial counterparts together with the federal government tomorrow afternoon. If there is one place where the federal government can continue helping us, it's with the Red Cross a lot more than the Army, because the Red Cross can help us, for example, in CHSLDs or places like that. So we'll never say no to help. And we're going to talk about it tomorrow afternoon. As far as the first part of your question is concerned, I said it earlier on and I will repeat it. We are closing no door. Right now, Dr. O'Patterney, a little bit earlier on this week, explained to you that there are many measures that we were setting up to prepare ourselves if ever we had to go much higher than the 1,500 beds, including 1,000 in Montreal. But those efforts right now, it's part of a whole series of efforts that are made. I was talking about the nurses. We have what we call dedicated COVID establishments. So there's all sorts of things that are being made available. And because there are regions that are not as affected, staff transfers could also be taken into account. But I think that we're going to be much better able to give you the state of the situation at the beginning of next week, because we'll see where we're at as compared to the inflection point that I was talking about earlier on.
Oui, est-ce que vous m'entendez?
Très bien, M. Gagnon.
Parfait, merci. Alors,
So,
si les effets du couvre-feu s'avèrent,
if the effects of the curfew show themselves to be positive, if the efforts that Quebecers are making right now work, and that the epidemiological situation improves, am I right to understand when I look at the common statement for public health heads of the provinces and the federal government that it would therefore no longer be justified to increase the interval between the two doses? If I summarize, that if the situation improves, you should therefore respect the maximum 42-day period? I don't make a direct link between the two. Perhaps Dr. Massé can talk about it, but first I want to be clear. I like hypothetical questions, Mr. Gagnon, and ifs and all that, but I can tell you one thing. Today, I want to be very clear, the situation is still very worrisome in hospitals. We are not saying that we've won the battle. Quite the contrary. We still have an increase today. We had an increase yesterday as well. You've seen the INES's report, which shows that things could continue deteriorating over the next few weeks. I just want to make sure that Quebecers understand that the situation right now is very worrisome. Now, what you're asking is, if things, and I'm saying if things improve, could it have an impact on the second dose? Well, I have a hard time making that link, because the second dose for us is, with the question, that is what we had asked public health to tell us, what is the best strategy to ensure that we are going to get vulnerable people as quickly as possible. Whether things go well or not, it's still the same question. To what speed can we vaccinate, taking into account the limited number of vaccines that we have? So what I would say to you right now is that the real question, rather, and I say it often, and I know that the federal government is making a lot of efforts to go get more vaccines, but the more vaccines we have, the more quickly we can administer the second dose. So there's a difference between the two. I don't know if Dr. Massé, you wanted to complete? Well, of course, the epidemiological situation puts pressure to intervene with certain groups. That being said, if we had vaccines, more vaccines, we wouldn't be there. So it's important to say that. And as we get access to more vaccines, we'll need that strategy less. Those things are going to sort of, fix themselves together. Once we'll have vaccinated enough people, the epidemiological situation, just naturally, the pressure is not going to be as high. And we work with an immunization committee in Quebec that has been considered, not only in Canada, but internationally, by experts. People who already work on the Canadian Committee of Immunization are present on that as well. So this is not a decision that was made by just a few people, behind closed doors. No, it's a process that was well thought out, a lot of exchanges, and those immunization experts are telling us that that is the right decision to make, that it is safe, and that it is what we should do. That is a recommendation that we had from the Quebec Immunization Committee. Premier Legault said at the beginning of the week that Quebec might vaccinate with the second dose within the prescribed delays if we had more vaccines. So now I understand that with the exchanges, as much with Ottawa as with the manufacturers, mean that that threat that we had from Ottawa last week, we don't have anymore. Well, listen, I make a difference between the recommendation that we have from public health and the agreements that were made with the equivalent of the SIC, the Quebec Immunization Committee at the national level. So what you're asking is the Minister for Procurement, and I will leave the Minister for Procurement make comments. What we have is that we've established a recommendation. We have received a recommendation, by the SIC and public health that makes us very comfortable with the decision that we're making, and we'll proceed. And even I added that we had discussions directly with Pfizer to explain to them what our situation was.
Bonjour, messieurs.
Bonjour.
Alors, juste pour rebondir sur cette question-là, vous avez mentionné...
Just to take that question on the fly, you mentioned many times having had discussions with Pfizer to explain to them what the situation is in Quebec and your position as far as the second dose is concerned. However, Pfizer and Moderna, have they given their agreement? Have they approved that way of doing that you've chosen? I will let public health answer that question. I think that our discussions were more to inform them of our decision and especially of explaining to them why we were making that decision. But I think that it was a very good idea to explain it to them. You have to understand that the company emits recommendations with the epidemiological data that they have, and they only have that data for 42 days. Very soon, they'll probably have data for 2, 3, 4 months. So that data will evolve, and we can understand the company for saying, well, listen, we only have data up until this, these many days. That said, when we look at the development of immunity related to vaccines, it gives us information that is essential in order to be able to make those decisions. And as I was mentioning, that immunity doesn't stop, from one day to the next. It's going to continue. Yes, we want to give the second dose to make sure that there is lengthier protection, but it will not stop. And we want to follow the recommendations of the company. I will explain to them it's not because we don't want to respect it. It's because we are creating a balance between delaying by a few weeks. And we have the impression that we're delaying by 12 weeks, But no, it's a delay of, there's already a delay of 21 days. So we don't delay by 90 days. It's less than that. And the other thing in the balance is the impact. That is our responsibility. It's not the company's responsibility. The company says I have data for 42 days, so I can't go beyond that. Fine. But our responsibility is to say, but we have an epidemiological situation that is serious here, and now we have to make that choice. And we helped ourselves with experts. We explained it to Quebec, to Canadian experts. We talked about it with the other directors for public health and different groups, and we explained it to Pfizer. And it doesn't have to approve us. We don't ask the company to approve us. We ask the company to continue procuring us with vaccines because we need them, and we believe that it is an optimal usage for a short, specific context, which, as soon as it's fixed, will follow.
Oui, merci. Il y a un moment donné où vous allez avec les nouveaux arrivages de vaccins.
With the new vaccines that are arriving, at some point, you'll have enough to start the second doses while giving first doses to other groups that you have in your priority list. At what moment will you be able to go to the second dose? Will it be when everybody who's 70 and over has received the first dose? Or when everybody 80 and over will be vaccinated with the first dose? Have you established a strategy? I'd love to have my chart with me, but I'm going to let Mr. Paré answer. Because we do have the answer. Yes, your question is a very pertinent one. We already have a projection as far as the procurement of vaccines towards the end of March. The week of 15th of March, we really have over 300,000 doses that are supposed to arrive that will allow us to continue vaccinating the most vulnerable people who are 70 and 80 and over, while allowing us to give the second dosage to the groups that have already received the first. And already, in the qualification that you presented very well last week, Mr. Massé, the chart, we had a plan for doses in our allotment for the end of March in order to be able to reach that objective. But at the same time, it depends, once again, if we get vaccines earlier, logistically, we do have the capacity to reorganize our schedules to vaccinate the second dose more quickly, depending on the vaccine and the recommendations of public health.
Bonjour.
I would like to know, we know that there was an outbreak at the Mémonide CHSLD, and I was wondering whether it is to be attributed to the fact that the people who received the first wave of vaccines did not develop a 92% immunity after 14 days. Richard? Well, of course, there is an evaluation of the situation that is ongoing right now to know what happened. These are people who are older, who are vulnerable. There is a possibility that the vaccine not be as efficient in older people. That's something that we're looking at right now. But we're not able to state it one way or another. We don't have enough data. But there is a team of epidemiologists, like the Institute for Public Health, together with experts in infectious diseases from the center who are looking at that data to be able to give us the answers to those questions, which are quite justified. I would like to know the decision of delaying the second dose from 42 to 90 days is based on the epidemiological data. However, there are immunology experts who fear that a partial immunity to the virus could bring about mutations that would make it that the vaccine might be inefficient. Have you considered that risk in your decision? It's part of the risks that are studied. But the virus did not wait for the vaccine to be there to start mutating. We saw variants already last year. There's a more significant variant or variants right now circulating in Europe and that have started in Canada and South Africa. So it's not an issue linked to the vaccine. It's an issue of the virus itself. The influenza vaccine, the influenza virus is an unstable virus, for example, which changes everything and it has nothing to do with the vaccine. But listen, it is part of the balance of things. But once again, that is not the main element at all, which brought us to look at the choices that we're making. It's really choices of the impact of not vaccinating. We could put it differently. The impact of not vaccinating for a period of 2 extra months. Who are we able to reach during those 2 months as opposed to immunity that does persist? I mean, you have to take that into account. And we are convinced that there's protection. Could it decrease? It's possible, and we will be monitoring. And if we realize, and I'm rambling here, but if we realize that there are older or more vulnerable subgroups for whom the immunity doesn't last as long, we'll have to react as a consequence. We'll generate that data, not just ourselves. The entire world is looking to get answers to those questions.
Madame Pelletier. Alors, nous allons maintenant.
We are now going to go to the English questions.
Félicia Parillo de Global News.
Hi, do you hear me?
Yes.
Perfect. So for Dr. Massé, Canada's Deputy Chief Public Health Officer, as you know, just reiterated during a press conference that if provinces decided to delay the second dose, it recommends not more than 42 days. They say they don't have the data that proves the dose is still effective after that 42-day mark. So what data do you have that they don't, that shows the first dose is still effective up to 90 days?
Well, what we have is the experience working with many vaccines through time and with the experience of immunologists that show that immunity is not something that is on or off and that it stops after 42 days. This is something which is much more gradual than that. So it's possible that there would be a decrease after a certain time after immunization. We are monitoring that. We know that delaying from 42 days to 90 days is a short period of time. And if there's anything that we see that indicates that certain people would have decreased immunity, we would give immediately the second dose. But as long as we have good protection for the population with the first dose, up to 90 days, we will immunize as much people that are very vulnerable to disease and hospitalization and death in certain cases. So we think that it's really worthwhile in our situation. It would be different if we would have a very low number of people infected like what we have in Eastern Canada. But this is not the case in the province here.
Thank you. And for Mr. Dubé, Today, Chief Ghislain Picard held a roundtable where First Nations leaders discussed the unique challenges facing their communities. For instance, the difficulty to find enough healthcare workers to send to isolated communities. Many of these communities don't have enough lodging to house health personnel who would administer the vaccine. So what's your government's plan to address these types of challenges in First Nations communities?
Okay, well, first, and maybe I'll ask Danielle to complete, but I'll say that there is a combination for these communities, that there are some federal responsibilities that are taken care directly by the feds. But also, on our case, we follow the recommendation that have been made in the order of priority that should be done. But maybe on the details of that, I can ask Danielle to comment on it.
We're working closely with communities and CISSS, where the Native community are present, and this is a kind of checklist that we have with them. Do they have enough healthcare workers? We provide all the materials. We provide vaccine, of course, and also we work on the social acceptability of vaccine. And so this is all the type of relationship we have with them. Everything is done with all respect, and basically we're partners. And since the last couple of weeks, we have been present in at least in 3 communities, Native communities, and everything went very well.
Alors, nous avons aussi des médias anglophones dans la salle. Donc, au micro 1, s'il vous plaît, spécifiez votre nom et votre média.
This is Kelly Gregg with CTV. My first question is for Dr. Massé. It was something that you addressed in the technical briefing. It's about this 90% protection that the first dose offers. From what I understand, that 90% protection is not immediate. It takes time to build up to 90%. Could you just explain how that works?
Yeah, it's really the way that you calculate the persons that are protected, or the vaccine failure, if you want. Normally, it takes some time between the vaccine and the fact of having good immunity. In this case, what has been shown is that it takes 12, 14 days to have immunity against the disease after immunization. So if you count people that get the disease after 2, 3, 5 days after the vaccine, it's not really a failure of vaccination, because immunity has not just taken up. You need to calculate the immunity afterward, once people have had time to develop that immunity. So if you redo the calculation that Pfizer has done, and you exclude the people that have made the disease before the 14 days to develop immunity, then it reaches the same proportion of people protected as Moderna, around 93 to 95% protection. So this is the way that experts in immunology calculate the efficacy of vaccine. This is the recommendation of the Quebec Immunization Committee, and this is approved by other immunologists in Canada and in Europe also. So it's just a way that you calculate things. It really shows that both vaccines are really very effective.
Okay. My second question is for Mr. Dubé. Yesterday, Montreal Public Health announced that there would be more ICU beds opening, but did say there is a nurse shortage. Are you considering forcing nurses in private care or who work in cosmetic surgery to work specifically in ICUs?
Well, I said there was a number of measures that we are considering right now. This is not one of them that have been implemented, but as you know, we look by region. I think it's probably easier to ask personnel to come from other region when they have the expertise, for example, in ICU, because the ICU need nurses that have quite experienced. So I think that we're not there yet, but being that close, this is the protocol that is being discussed, and on that matter, we will follow recommendation of Dr. O'Patterney. But as I said earlier, and I think it's important to repeat, that we are at the crossroad of that at those numbers in Montreal. The good news is if you see the stabilization in hospitalization, that will be a good news. We see the number in the cases, but we haven't seen that in hospitalization. And that's the reason I think when we'll come back next week, because we will be back next week, hopefully we can see that on the hospitalization, and then we can have that discussion. What are the other measures? But let me just assure you that Dr. O'Patterney and her team are preparing for that in case. Well, we are preparing for that.
Maintenant, pour le micro 2, s'il vous plaît, aussi votre nom, votre média. Merci.
Bonjour, Elizabeth Zogalis, CJAD. Looking very far ahead, the Order of Pharmacists and pharmacies in Quebec say they're ready to start doing vaccines if they want to, if they can. Is that something that the government is slowly working on getting towards?
Well, first, we're talking to them. We had a call this morning with the organization because we're informing them, well, not only the pharmacists, but the dentists and many professionals that we are informing them on a weekly basis as we progress. And before asking Danielle to comment on it, but quickly what I would say, remember that at this level right now, when we vaccinate 10, 15,000 persons per day, to us it's very, I wouldn't say easy, but it's business as usual because we can vaccinate with our staff for influenza 50,000 people per day. So right now we don't need those extra, but we are in discussion with them, one, for training, and second, to make sure they know when approximately we'll get them. But maybe Danielle want to add something on that.
Oh, and as Mr. Dubé said, I truly believe that community pharmacists could be an ally for a vaccination campaign. Two main challenges right now. It's the limited vaccine number, so this is the first obstacle, and also the type of vaccine. As you know, if I look at Pfizer vaccine at minus 70 degrees, it's impossible to be able to distribute it in small community pharmacy. Moderna is definitely a great possibility, but with a small number of vaccine that we have right now, we cannot consider this option for the moment.
And is there a ballpark figure when you think this can really start to roll out in the pharmacies?
Well, I think the number of vaccine, when we start to receive, Danielle was referring to a delivery of approximately 350,000 doses that we received in the first week of March. I think then you'll see that we are able to do first and second dose. So then I think that's the reason we know we have a tight rope for January and February, but when we enter March, I think that will be much easier.
Merci beaucoup.
Bienvenue.
Maintenant, Morgan Laurie de Canadian Press.
Hello, can you hear me?
Maybe a bit louder if you can, please.
Okay. My question is about people who have tested positive for COVID-19 in CHSL days after receiving the first dose of the vaccine. I was wondering how many cases there have been of that and how many CHSL days, and if you've seen any testing positive after 14 days after receiving the vaccine.
Yeah. Well, we are monitoring the situation. In fact, there are 2 CHSL days where there were outbreaks at the time that we initiated vaccination. The outbreak were there already. And we decided to offer a vaccine to see if we could decrease or stop the outbreak. In fact, it didn't. And we continued to have cases among residents in both places. I don't have the exact figure in front of me, but there's been cases after the 14 days of people being immunized that arise. But we are just looking at why that happened. It could be many reasons. One of the reasons is that the vaccine is not fully protective. So 93% is not 100%, and it could be lower than that for people that are elderly. So there could be people that would get infection because they are not well protected. And we're looking at has there been any other causes that explain that? And we are doing that investigation with the INSPQ, both in Montreal and in Quebec City. And if it happens in other centers, we are looking at outbreaks, the situation, people that are immunized, unimmunized, and if there are any other reasons that could explain why this happened. So we're looking at that.
Okay, perfect. And just as a follow-up, maybe for Mr. Dubé, I have a question just about the vaccine delivery. Are you satisfied with the pace which you're receiving vaccines? Because I know you mentioned, I heard this morning that some regions are almost out of doses. Is it lagging behind what you would like to see?
I'll say that we recognize the effort, but we're not satisfied. It's just because we have so many people that we want to vaccinate. We realize, and I salute, I don't know if that's the right word, of General Fortin, of all the works they do, and I think we do appreciate the work, but I think when we comment that we want more, it's not that they're not doing the effort, but when we make those tough calls, as we do every day with the itinerant, with the personnel, I would say we're not satisfied, but it's a matter of numbers and not the service that we're getting. We're getting a very good quality service from General Fortin and his team.
Et maintenant, pour un dernier média anglophone, nous allons passer à Elias Aboud, CBC.
Hello, can you hear me?
Yes.
With your discussions with Pfizer on this extending the delay for the second dose up to 90 days, what was your sense on whether or not how much they approved this plan?
As I said, and Richard has said the same thing, but he can comment again. We didn't ask the permission. We informed them that it was a recommendation that based on our experience that we were comfortable doing in the circumstances. They know the discussion that we have with the feds, with the CCNE. And again, Dr. Arruda was very clear yesterday when he discussed those instances, and everybody accepted on that committee. They understand that the situation in each province can command or can dictate a different approach to take into account the clientele that we have. And in our case, given the absolute number that we have and those vulnerables that we need to take care very quickly, I think that that was just a good relationship that we have with the manufacturer to inform them of the strategy. And I think that Dr. Arruda did the right thing, and we appreciate the collaboration that we have with Pfizer.
And Mr. Dubé, one last question for you. Your ministry is still permitting non-essential cosmetic surgery, such as breast enhancements and facelifts in private clinics. These are all surgeries that require nurses, respiratory therapists, anesthesiologists who also work in the public sector. Why are you allowing these non-essential procedures to continue when the province really needs staff and you're postponing thousands of necessary surgeries in hospitals?
Well, we're trying to keep a balance here. Remember, a few weeks ago, we didn't have to do the délestage that we do right now. If we need to do additional things, as I said, every option is open. At this stage, we're trying to keep the right balance, and we rely on those opinions that we have. If we need to do more, we'll do, but let's take it as we do. Let's look at the planning that we've received, not as early as this morning from l'INES, and I think they see some stabilization, but again, I think in the next few days we'll be able to give you an update and hope we'll see the benefits of that curfew that we have right now.
Alors, c'est ce qui met fin à la conférence de presse.
So this puts an end to today's press conference. I thank everyone for their presence. Thank you, everyone, once again. Be prudent. Thank you.